Next up, we've got Oklahoma Medical Marijuana Authority. Director Berry, you want to run us through your presentation? Appreciate it.
Yes. Good morning. Thank you for having us. We have accomplished a lot in the last year. We'll go over a little bit about of what we've done since we saw you last. But I do want to start off by letting you know that we are asking for a flat budget. We are not asking for any increases. And over the last year, we have, I'll go through some of that. Let me see. Let me see. It is not. Oh, wait. There it is. Thank you. A little history. As you know, we are going on about 4 years as a standalone independent agency. We were under the State Department of Health when State Question 788 first passed, and we were pulled out in 2022. Since then, it's just been, we've been accomplishing a lot of building the regulatory framework, enforcing and refining our licensing processes, doing things that we are kind of having to do backwards. I think we're getting to a really great place where we're finding a stride, and hopefully you'll see that through some of the work that I'll show you today, but also through the what you're seeing out in your districts. We did have all of our inspectors certified this year as a national certified investigator and inspectors through CLEAR. We established a patient services unit, which is a public health unit within OMMA. That unit is focused on the patient licensing, patient education and outreach, collaboration with medical professionals, and we have our first ever epidemiologist on staff helping us to gather all the data and know exactly what story it's telling us so that we can address what the story is. Our current focus right now on the patient services side is our youth use working group. We established that in 2024. We have 32 agencies and organizations at the table with us, including DHS and OSDH. Those are two of the larger agencies that are at the table. We're working towards a statewide education campaign regarding youth prevention. There has been a lot of information given to us by the Poison Control Center. We hear from ER doctors about increases in children 0 to 5 years old coming to the emergency room with accidental ingestion. It is increasing, and it is a problem. So we are all at the table together to work on that. We have been out in the field. We've gotten, this past year we did over 5,500 compliance inspections with a goal of doing 2 per year at every place that we can inspect. There are some places that we cannot go to because we're regulatory inspectors and we know that maybe there's an investigation going on, or we're told that it would not be safe for our inspectors to go there, but that's a small portion of our licensees. We did file over 360 administrative cases last year, and we are increasing that due to really refining our processes and having the right people on the team to just be out there getting stuff done every single day. And I will move on to talk a little more about some of the challenges. We filled every spot. We have challenges, and sometimes we don't even know that the challenge is going to come until we figure it out. We are working to get ahead of things by working with other states that have done this before us. There are states that have had legal cannabis for decades now, so we can call them and get advice and try to get ahead of things. We don't have any federal oversight. We don't have any federal framework, so we really depend on other states to help us and guide us in best practices. But some of our some of our challenges have just been making sure we do have the right teams, the right people, the right processes, the right training. We started and built all of that from scratch. So the patient services unit is a product of doing that research and figuring out what we needed. We needed that public health arm at OMMA. But we have to make sure that we are monitoring the data and moving in real time and with what the data tells us that we need to address. So there are also a lot of environmental challenges, which I'll focus on number 2. We've heard a lot about recently the abandoned grows, grow facilities where we've revoked the license and maybe the owner just skipped town or skipped the state and left it in disrepair. And so working with DEQ, working with other industries, we've sought guidance and counsel from the oil and gas industry, who has had to clean up abandoned wells for many decades as well. So working on that and figuring out what that team looks like within OMMA, we're building a new EHS team within OMMA, Environmental Health and Safety Team, to be the subject matter experts on that within our agency. There still are fraudulent materials submitted to us by some licensees, but we've gotten a lot better at identifying those, working with the Organized Crime Task Force to address some of that when it's a bigger picture straw ownership scheme or bigger picture criminal organization. We've had some technology challenges since day one. They're not over, but they're getting a lot better. We did implement a new licensing and inspection software in October of 2025. It was our first ever inspection software. Our inspectors were out in the field using basically a glorified spreadsheet for many years because we did not have software. Now we have software, and licensees are able to go into the portal within 5 days to see their inspection reports. That's new. That's an efficiency that everyone appreciates. But on the on the licensing software, the build out took about a year. We launched in October, and the data coming over from our old system, which that system was already not very efficient, but the data coming over, it's been a struggle to make sure it's all matching up. We're getting to a better place. What I will tell you about the licensing portal, it's called the OMMA Med Portal. It will be an amazing, amazing tool once it is fully refined, and we are getting there. October to now, we have made a lot of progress in cleaning up the data and making sure it all looks good. Then we're obviously always anticipating potential changes, including federal changes. Rescheduling is one. There's talk about that at the federal level. And there's no way for us to know what that would look like or what the impact would be until we actually see the rules that come down. We can guess and we can talk to people on the federal level and try to have an understanding, but we're just always keeping an eye on that. We did find some efficiencies this year, and one of those is that there was some space on the third floor of our main building that we were able to give back to the state. We gave it back to OMMA, and that saved us as an agency, OMMA, over $77,000 this year. We did have a reduction in force at the beginning of FY 25 that did create some savings. And we are continuing to implement automated processes. So processes that can, or automation that can process some of our applications, like our credentialing application for employees of the industry. So those are some of the areas that we've found ways to find savings, but we are continuously looking for ways to save. We have some goals, and I'm happy to say that since we were here last year, we have greatly improved our licensing processing turnaround times. We were living really close to the 90 statutory day turnaround time in processing licenses last year when I was here talking with you. But we are down to, I believe, 13 days. Yes, we're at 13 days right now. Part of that is the new Med Portal, but part of that is also truly just having the right people that came in, identified bottlenecks, fixed it, and put the right processes in place. So I'm very proud of the team. They're working really hard, and they know the expectation is to turn those around in a timely manner. Same for patient licenses. We're at about a 4-day turnaround on patient license processing right now. We did inspect nearly every business twice this past year, which is a first ever in agency history. And we started our secret shopper program. So last year we did secret shop 50 dispensaries, and this year, fiscal year, we will do 10% of total dispensaries. And we've been able to utilize our QA lab that we opened the doors on to do some of that testing. Our QA lab doors did open. We have instruments. We are going through accreditation. Some of our methods are validated. Some are still going through the process for ISO 17025. But it is a work in progress, and we've made a lot of progress there. There we go. We do have some big projects for fiscal year 26. Continuing to build out the new software and make sure that it's working properly, but also finding places we can automate, because that's what it's built for. Finding places that we can find efficiencies, and we're going to find some this year. Our QA lab continuing to get that rolling and get to the point where we are testing 100 samples per week. We are continuing to, we do have a couple of big education campaigns that will be coming up this fiscal year. One is DUI cannabis campaign, which we're working with DPS and other stakeholders on that. And then the other I mentioned previously is the youth education. And that is multi-pronged, going out to schools, but also putting out public service announcements and that kind of thing over the next year. FY27, we will continue working towards automating, continue ensuring our QA lab is operating at the highest level, and continuing to ensure that we are focusing on customer service. We're finally opening our lobby so that patient licensees can come in and receive face-to-face customer service. It took a little while because of construction and working with OMMA on their deferred maintenance. We are ready to open up and serve the public there. So things are going well. There's exciting things in the future, and our ask is flat from last year, $37.6 million, and I will open for questions.
Thank you for that, and I'll start by saying thank you for having a flat budget. That makes it much easier for us. Anybody, questions? Representative Ransom.
Thank you, Mr. Chair. You had talked a little bit about the portal launched in October and how there has been some difficulty from the old data transferring over, that you're making progress, which is fabulous. What is the timeline for completion?
The system is complete. It's truly just, and I will look at, do we have a timeline that we can say? It's truly right now identifying the problems, and we're fixing them as quickly as we can, which is a collaboration with OMMA a lot of times. They've had to come in, and they've actually invested some of their own budget on helping us with this, because there was I'm not a technical expert, but there was a B2C issue with people who didn't use the same email address they used in the old system. It was blocking them from getting into the new system. OMMA invested some funds into fixing that and making it better for patients and businesses to get into the portal, better and easier. And that took about a month. That wasn't until about November that they did that. Right now, we're processing applications. We've processed over 30,000 patient licenses since the launch. So things are working. There are just still bugs that we're learning about and then getting them fixed.
Follow up.
Thank you. Well, from the dispensary side, the folks who are, I know that right now we are in an employee credentialing period. The fact that the portal is not functioning to its best usage is a struggle and a frustration on their side. And I'm curious, though, as far as in the place of this portal not being up to scale to where it needs to be, talk to me about the call center. How many people do you have answering the phones so that way these employees can get their credentialing?
Yes, we've increased our number of people in the call center. We've brought people from other departments, but we also have a couple of employees that are just focused on credentialing. I mean, they're doing it in real time, same day turnaround, I believe. Okay, so as soon as we realized there was a problem, we basically threw people at it. We pulled people from other departments to address it. So if there are specific issues people are still having with getting their credential, I'd be very interested in hearing those details. But we've added people to our call center, and we've assigned people to specifically work on reaching out and talking to people who have credentials or are having problems, and that's all they're doing every day.
Follow up.
Thank you. Well, as of a couple of weeks ago, call wait time was 6 hours. And so the fact that if every employee has to do their own calling in and an employer can't call in once and then pass the phone, then that adds to the backup. Obviously, 2 weeks is a long time ago, and I'm hoping that things are changing for the better. But if the deadline is January 31st for all employees to be re-credentialed, is there going to be some way of a leniency for those who aren't able to get it done because of technical difficulties on OMMA's side?
Yes, I really appreciate all of these questions, and they're very fair, and we need to be held accountable for the issues we've had with our call center. A lot of it has been not having the proper software in place in the call center. Things that hindsight's 2020, but also there should have been foresight to prepare some of these things before the launch. However, I will say I think things are better. I will go back and meet with my team and make sure. We have consistently told patients and businesses, and I'll include credentialed employees in that, they will not be penalized for anything because of a technical error on our side. So we would extend those dates if it were an error because of our system. And that's what we've been doing. But I will go back and talk with my team and meet with them and make sure that this is addressed.
All right, thank you.
Representative Chapman.
Thank you, Mr. Chairman. Director Barry, how long have you been in this position?
Since August of 2021.
Yeah. Well, I just want to commend you for your hard work. I mean, you took something that really didn't exist and was maybe a bit of a mess, and I think you made a lot of progress. I've had multiple conversations with you and with, is it Ashley?
Mm-hmm.
Yeah, and I don't know, it just, I think you've done an admirable job. I just want to point that out. And keeping it a flat budget is obviously a plus. And I forgot my question, but I guess, you know, the compliance side and the bad actors in the business. I mean, does this budget help you address those problems, concerns, abuses?
Yes, as of right now, the plan is to, some of the processes we're going to automate will allow us to move some employees from areas that they're no longer going to be needed, and we can shift them more to the investigation side. We can open up those positions on our investigations team. That's where we do need a few more employees, but we're going to be able to shift. We are also we've built more partnerships than we've ever had. For example, last week we were out in Kay County working with their drug task force, working with the DA out there, working with the local law enforcement, and then OMMA, and the operation went off without a hitch. So building those relationships and having the people that will come to the table and assist across the state has been the key so that we don't have to build this super mega agency that has a big law enforcement unit. We can depend on the law enforcement that's already out there to assist, and that's what we've been focusing on.
Representative Pogmiller.
Thank you, Mr. Chair. Just to clarify, is the compliance, the inspect every licensed business, is that growers and sellers?
So yeah, growers, dispensaries, processors, waste facilities, transport.
Okay, and all of them are twice a year?
And labs, yes.
Okay.
Representative Stark.
Thank you. Thank you for being here. Thanks for all your hard work. I just would like to know approximately how many grows, how many dispensaries do we have today?
Today?
I mean, I know that changes.
Yeah.
So
I think
I'm
I
not
have
asking
those.
you to hold it on, but just approximately.
Okay, as of January 2nd, 2026, we had 2,261 licensed OMMA growers, 1,453 dispensaries, 710 processors. 710.
And how many grows did you say?
2261.
Sorry, what date?
January 2nd, 2026. We have 19 labs, 8 waste disposal facilities.
Follow.
So with the 710 processors and the grows, are some of those the same?
Yes. Well, they're vertically integrated. So there might be one business that has all 3 license types, like a processor,
Okay.
dispensary, grow.
And how many are inside grows? Do you know?
I don't have that information, but the majority of our licensees are inside grows. So we can get that for you.
Representative Marty.
I don't think it's been filed yet, but I hear there's a potential, and all the stakeholders have been talking about whether we actually need seed to sale in Oklahoma, whether it's actually benefiting the consumer, the business owners, making your jobs any easier. I've heard from multiple agencies, and I know there's some interest in the building to get rid of a system that many don't believe is doing that much as far as diversion. What would that look like from a financial standpoint? You look like you haven't heard this conversation.
I think that's wild. We couldn't do our job without some sort of data tracking on the industry. We couldn't do recalls. So I think that's wild. Cost savings for us, I think $50,000 a year is what we pay for metric, and then the industry pays for their tags, and I think $50 a month.
Okay. and again, this isn't a policy hearing, but what about getting rid of the tags themselves versus the system as a whole?
I don't know what that would look like, but totally open to the conversation, of course.
Again, that doesn't save you guys any money,
No.
but obviously saves the folks out there buying those tags a lot of money.
Follow up.
I have my notes here from last year, and I didn't see it. It looked like from fiscal year 2025 to 2026, we changed to a budget line that says science.
Mm-hmm.
Can you tell us what that line means?
Yes. So our science department, we used to call it labs, but it's more than just labs. So it's the team that oversees the lab compliance inspections. They also work in the QA lab. The patient services, public health department is within that unit. So we encompass it by calling it the science department.
Follow up.
So including the cost of going forward and running the QA lab, that's all
That's on the science line? Yes.
Okay, thank you.
So on your budgeted FTEs, you're currently sitting at 31 budgeted but unfilled. Are those is that just normal kind of churn, or are those positions that you're having a hard time filling? Are they new? What's the nature of that difference there?
Thank you for that. Let's see. We have 6 in process right now that are currently posted and that we're interviewing for. And some of those are forward-looking. With the QA lab, we're not exactly sure. We think we're going to need a few more analysts in the lab, some bench folks. And further, all the conversations around land reclamation and bonds, we're not sure if we're going to need some of those spots to have some employees in an environmental position to oversee that. So some of those are a little bit held because we know things are coming. We're just not exactly sure yet what those positions are. But we do have 6 in the pipeline right now that we are hiring for. We've had really good applicants. We've been very lucky.
Okay, good. And then one thing you didn't touch on, but I wanted to give you an opportunity to brag about it, is your transport license turnaround time. Did I hear we're now looking at like same day?
Yes.
On that?
Yes.
So
transport agents. Yes.
That's pretty impressive. Congratulations. Any other questions? Anybody? All right. Well, thanks so much for coming.
Thank you.
Appreciate it. We're going to adjourn until 1:30. We'll break early for lunch and get back here 1:30, and we'll follow up with Department of Health, Veterans Affairs, and University Hospital Authorities and Trust.